Welcome back. So do you have long-lasting nagging pain that just won't go away? If so, you could be one of 51 million people suffering from chronic pain.
So chronic pain lasts for at least 3 months and can be anything from a dull ache to a shooting pain. So joining us now to talk about this is Dr. Anna D. She's a chiropractor and the owner of Unity Chiropractic Wellness. Dr. D, thank you so much for being with us. So this is something that I know, as we said, affects so many people across the country. As a chiropractor, your focus is on people's muscles, on people's skeletal system, not necessarily prescribing medication, but let's just start with some basics. The warning signs. How do you know if something is actually chronic pain, not just something that's going to maybe annoy you for a little period of time?
So when it comes to chronic pain, it's usually something that lasts between 3 to 6 months, and it's occurring even after sometimes the initial injury is gone. Sometimes the initial injury is gone and you're still feeling pain, or sometimes you're feeling intermittent flare-ups of the pain. And when it comes to temporary pain, that is something that you kind of expect that the pain would go away, and then it does, such as a sore throat or pain after you work out, the pain goes away. But when it comes to chronic pain, sometimes it's just pain that continues to nag you.
So I will admit, I do this, and I'm sure a lot of you guys out there do it as well. You have an injury, you get some form of pain, and months go by, and you just kind of expect it to go away, but it never does. Apparently, there are some risks associated with having chronic pain.
Yeah, so if we're talking about what types of things might lead to someone developing chronic pain, there are a variety of environmental, emotional, physical things. If you have had surgeries in the past, or if you've had injuries in the past, or if you have conditions like rheumatoid arthritis, diabetes, fibromyalgia, those can all alter your perception of pain and also complicate your recovery in those in certain injuries. There's also a genetic factor that puts you at risk. For example, if you perceive pain differently than others. Everybody perceives their pains differently. Everybody might also say, some people might say, this pain runs in my family. And when it comes to that, it might not be necessarily that it literally runs in your genes, but it might be that you are doing the same things that your parents and your traditions do. So if your parents take a warm bath when they have lower back pain, that might be something that you do. Because if you're doing the same things, you might be feeling the same types of pains. So it's important to kind of figure out what might be causing your pains.
Because it's so different for everybody individually. If you could talk a bit more, you kind of touched on this a moment ago, about what we know regarding chronic pain and mental health. How are those two things connected?
So there is definitely a connection with that. It's kind of like a two-way street in that whatever you are feeling physically, you might also feel that emotionally. So sometimes people can recall a specific incident where they might be, really stressed out and they're holding themselves very, very tense. And even after that emotional episode is gone, if your body still remembers the feeling of being being tense and stiff, you might confuse that with, am I still emotionally feeling bad right now, right? So it's important when you're trying to take care of your pains to address both the mental and physical aspects that are leading up to that.
Because there really is this mind-body connection.
Yeah, there is.
That's intriguing, mental and physical components there. So let's talk solutions. What are some things people can do to mitigate or lessen or in any way treat chronic pain?
I think what most people do is most people will just reach for the over-the-counter pills that
Advil, Tylenol.
Exactly. Those things actually just mask and mute the warning signs of the pain. Or some people might even be subscribed to an indefinite course of prescription drugs throughout their lives. And I'm not saying to stop the drugs. I'm just saying, consider that there might be some pains in your body that might not be necessarily related to what the drug is actually treating. So if it is a musculoskeletal pain, if you're feeling pain in your hands and your feet, you might you might be better off seeing a chiropractor, physical therapist, acupuncturist to take a look at that, because not everything needs to be answered by doing pills and things. Sometimes strengthening can help as well, because some people rest too long. Sometimes if you are laying in one position, you're not getting enough oxygen, you're not getting enough blood flow to your body. So it's important to strengthen things in order to improve the structure within muscles to tolerate the loads that you're doing throughout the day.
So to follow up on that, it's interesting. We did a story earlier about the woman who's more than 100 years old who can she can hold a plank for 3 minutes, and her secret to longevity is to move. So are there things we can do as we age to kind of reduce the risks of chronic pain?
Yes, yes, there is. You know, I always tell my patients that your body, if you think of it kind of like a ladder, even if you have a really old ladder, as long as you learn how to climb that ladder, right, then you're never going to fall off the ladder or find that you can't climb it and do the things that you want to do. So it's important to keep on moving. Otherwise, if you just resort to resting, you might forget how to move. You might be nervous moving, and that can cause pain. So I encourage people to keep on moving and then keep on, you know, strengthening it.
All right, today's a great day to do it too. Nice weather out there. Thank you so much for joining us, Dr. D. Really appreciate it.
Thank you for having me.
We'll be right back.